As it has been mentioned during this very interesting meeting, the SOHO meeting, this is the 2023 is the year of lower risk MDS. This is because we have two studies that have been completed and published, and the results are extremely positive for lower risk patients with anemia and transfusion-dependent anemia. The first study is the Luspatercept study, the COMMANDS study, that was enrolling patients with low risk MDS with transfusion dependent, both with ring sideroblast and non-ring sideroblast. And in this study, the endpoint was to obtain transfusion independence for 12 weeks, so a longer duration than usual, and a concomitant increase of 1.5 grams of hemoglobin. And this endpoint was met, and the patient in almost 60% of cases became transfusion independent, significantly more than the patients who received EPO, because the comparison was between first-line patient who received either Luspatercept or ESAs. So we know that ESAs are not effective in transfusion-dependent patients. So the very interesting thing is that we have another tool to obtain transfusion independence in this rather difficult subset of patients to treat. This was the first one, so this led to the approval of Luspatercept for first-line patients. And then a very interesting study was the IMerge, the study in which transfusion-dependent patients with lower risk MDS, according to IPSS-R, were treated with Imetelstat, who's a telomerase inhibitor. The results were of course, the objective of the study was to obtain transfusion independence, and this was met and significantly higher than the placebo arm. So the patients achieved more than 40% response, and the duration of the response was extremely interesting because 1/3 of these patients had a response that was pretty long, and almost 20% more than 1 year. And the placebo patients, of course, didn't reach any transfusion independence as long as these. And on top of these data that are very interesting and confirming the activity of Imetelstat in this subset of patients, I also want to add that this patient had a pretty high burden of transfusion. So this is quite a new thing. Patients who receive more than 6 units red blood cells in 8 weeks were able to respond pretty well. Response was obtained irrespective of the baseline characteristics like telomerase activity or telomerase length, but Imetelstat had a disease-modifying effect. So the patients who obtained a response had a more than 50% decrease in ring sideroblast in their bone marrow, respect to placebo, of course, very much significant. And then they also had cytogenetic responses, so that was also a very important observation. But the one that really was more intriguing and really intriguing was the fact that the variant allele frequency of the genes that were mutated, the most recurrently mutated one being SF3B1 and DNMT3A and TAT2, were decreasing. So the significance of the decrease can really mean that we are obtaining a modification of the natural history. And this is something that we really need for lower risk MDS patients.